Hi, I'm Arshiya. You might recognize me from my story shared on this channel. My son Nirvan was actually born with eczema, and after trying many things, what helped him was a skincare range with a triple oat complex which drastically improved his condition. When it comes to your baby's sensitive skin, I feel that it's best to trust an expert, and that's why we have Dr. Sanjay Wazir, Medical Director of Neonatology at Motherhood Hospital. He's going to deep dive into essential newborn care with a vast experience in managing newborns. Hello doctor, welcome.
Thank you Arshiya, thank you for having me over here, and I'm happy to be here and happy to answer any of your questions that you have for me.
I remember being so scared giving my newborn his first bath. There were so many questions running through my head and my search history. So can you tell us when a newborn should get his first bath and what are the safest practices for it?
All searches should not end in internet, and sometimes you may need to refer to a doctor or a dermatologist. And as far as the bathing is concerned, at one point of time we used to bathe the children the moment they were born, but we realized that this was removing the protective vernix caseosa layer from the skin and also causing hypothermia. Now the recommendation is that you should delay the first bath for at least 24 to 48 hours after the birth, when the baby is slightly more comfortable. And as far as practices is concerned, so one, the temperature of the water should not be too warm or too cold, and the best way to find it out is putting your elbow into the water, and if you find it to be comfortable, that's the right kind of a temperature. Also, you should make sure that the bathing does not happen more than 2 or 3 times in a week, because very frequent bathing can lead to dehydration of the skin. When you use the product, make sure they are meant for the babies and not the adults, and make sure they contain the natural ingredients as well.
As parents, we are exposed to a sea of products for our babies. So how can we trust what to use for our baby's skin, and are there any specific ingredients we should look out for?
As a doctor, I would tell you not to go with only the advertisement. It is better to look at the back of the product, which gives you a lot of information about the product and the safety. The product would mention that it is hypoallergenic, whether it is fragrance free or not, whether it contains the natural components or not, like oatmeal. And these are some of the labels that you need to look for when you're looking at a product, rather than just looking at the tagline or the packaging.
It was such a pleasure to learn so much from you, Dr. Wazir, and as a parent, I feel so much more confident after our session.
Thank you Arshiya for having me over, and I'm so glad that it has helped you, and I hope it has helped some of your audience as well.
So if you want to learn more about your baby's skin, keep watching Your Baby's Sensitive Skin Expert.